Welcome back to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And we're going to be talking about neighborhood health. Literally, we are joined by Dr. Michele Blackledge-Polk. She's the Director of Oral Health with Neighborhood Health. How are you doing, Michele?
I'm doing wonderful. How about yourself?
Doing very well. So let's start with a little bit of the background. Multiple locations, primary health care, dental health care, behavioral health. Give us some background, though, on neighborhood health.
So neighborhood health has been instrumental in the community of Nashville for over 45 years. We celebrated our 45th anniversary last year. So we actually have 13 locations that serve Middle Tennessee. Mostly are in Nashville, but they do have one in Lebanon, Tennessee. We're a patient-centered medical home. So what that means is we, like you said, we do offer dental, medical, behavioral health. So it's like a one-stop shopping, but we have that ability to commingle. So if you have a problem with your medical provider or the dental provider has a problem, we can all talk together and figure out the best way to handle your overall health, and it's just not your dental health.
When you talk about having multiple locations, I think convenience obviously plays a role. So being in the neighborhood, also too, the ability to move quickly. And so you've got the collaboration on your side that you mentioned, but also too, the convenience of the location and the convenience of kind of everything being under one roof. Talk about some of those different things that make you very unique and special.
So the biggest thing is sometimes when you go to the dentist, you might have uncontrolled hypertension. That we are able to catch, and we're able to speak to your provider, especially if you're dealing with one at Neighborhood Health, to come back and go back and say, hey, guess what? Patient A is not being treated correctly, or they might have not been taking their medication correctly. So together we come in the room and say, listen, now you have your dental provider and your medical provider here. What can we do to make sure that you're following the guidelines that we're telling you? Because your overall health is the biggest benefit for both of us. We cannot treat you in certain situations if your blood pressure is over a certain number. So that kind of gives people a pause when they come to the dentist and they say, why are you checking my blood pressure? Well, dentistry is just not with the mouth. Dentistry is the whole body. So we have to make sure that you're overall healthy. And at Neighborhood Health, we are able to do that. And I want to say that we're one of the only safety net places that has all three in Middle Tennessee. And that makes us kind of unique in that way. So we're able to treat the patient, but also treat families. We have pediatrics here. We do vaccines. We have food banks. Pretty much whatever you need is here. If you have a problem getting to one of our clinics, we also have transportation. We're very unique in that. So there's not really a problem that we don't have. If you don't have insurance, we have patient navigators to sign you up. If you're lacking TennCare or you don't understand your services or what your child is eligible for, we can have someone come in the room and sit down with you.
I know you also have translation services. So to your point, holistic care and really having a solution for all the different challenges. Give us an illustration of the population that you serve in the sense of, I know it's obviously a wide variety, but kind of paint the picture of the individuals and the families and what they're going through, the challenges that they're facing, especially as you're talking about having the food bank side of this and the partnership and the transportation, why that's so important. So give us an illustration around the families and the individuals you serve.
So we mostly see African Americans and Hispanics. The majority of the Hispanics that we do see are not residents, so they might have a language barrier. We do have a language line. We do have multiple staff that speak multiple languages. So we're able to go back and forth and have a conversation so that they do understand and they don't feel left out, that maybe I only know a little bit of Spanish, but I'm able to have someone on the line to give them that full detail of what is needed for their overall health. Some of the challenges that I see with some of our patients is they have to choose. They have to choose between, are they going to feed their kids today? They're going to get this tooth extracted. Are they going to come because they have a hurt foot or they have an open sore and pay for that visit? Or are they going to make sure they have gas in their car? Right now, we have to be very sensitive to the fact that what we think might be affordable might not be affordable. And so that's where neighborhood health comes in. We have foundations such as Smile180. We had Smile160, and we have other partnerships that are able to offset the cost. So most of our population that we see are underinsured or uninsured. So we have a sliding scale that allows them to pay little and sometimes none. If you're homeless, you pay nothing. So we don't ever turn anyone away for the ability to pay. And so that's another unique situation with us. We absorb that cost and we want to make sure that our patients and overall Nashville is safe and healthy.
Yeah, I think that's a huge point that for me personally, I want to make sure that everyone understands because I love that aspect of what you're doing. Let's talk about oral health. Talk about why taking care of your teeth, your oral health is so important, and not just from the nutritional side and functionally being able to eat, but also too just for your smile and your career trajectory and opportunities in life. Why is a healthy smile so important?
If you've never had to experience dental pain, you probably never will want to. A lot of people, especially the patients that we see, they have chronic dental pain. And it's not for, sometimes it's lack of education, sometimes it's lack of money, sometimes it's lack of transportation. Again, they might have to choose, do I pay for this, to pay for that? Sometimes it's substance abuse, but everyone deserves a second chance. And so we're here to do that second chance for you. So there's nothing that we can't do. A smile is really important because guess what? When I say hello to you, that's the first thing I do. I might be feeling good on the inside, but if I can't project that, that creates a problem. So a lot of times we see patients like this and they hide their smile, even though they might be very happy on the inside, but that might create a problem with getting the job because someone might say, well, they didn't seem very outgoing or they didn't seem very receptive. And it's not that, it might be an embarrassment of how they look. So what we try to do here is make sure that they leave how they want to leave. So we always ask that question, what are you trying to gain out of this? What do you want? Because that's the only way that we can get to the finish line is if we know where we're trying to go. A smile will make your day or break your day. I've seen people walk in here without teeth and walk out of here smiling. Of course, COVID has created a problem with masks and they have to hide it, but they're so happy. And you see the excitement and their families are like, I've never seen them without teeth. I can take pictures now. I can go to my son's wedding and be confident. That makes it all worthwhile when we do what we do.
Talk about what you do on the dental side. So obviously cleanings, talk about the different services when it comes to the dental side.
So we are able to offer emergency services, same day services, walk-in. We do cleanings, fillings, extractions, dentures, and partials. If you bring your child in and they have a tooth, we're going to clean it. We're going to talk to you about it. We're going to give you some oral health care instructions. We want to see them as soon as they get a tooth. And the reason being is because we want to provide the education for the families. And sometimes we get the kids in and then the parents say, well, hey, can you see me too? Absolutely. And it goes vice versa. So that's the biggest joy and takeaway is you need to get in as soon as you can and get that education. We have wonderful providers. We have wonderful hygienists. We have wonderful dental assistants. So everyone is here to help you along that way. And there's no question that we won't ask. And if we don't know, we'll find out for you. I think the biggest thing that I want people to understand about oral health is it's not oral health, it's total health, right? Because your body accumulates all of this. So bad teeth periodontitis causes heart disease. I mean, that's been cited in multiple studies. So we want to make sure that we're treating all of you. So if you start at the one thing that the people see, the one thing that you use the most of throughout the day, and let us take care of you, you'll be fine overall, and we can get you where you need to go.
When you talk about tips and recommendations, especially for parents with children, what are some of the tips? And I'm thinking obviously like, making sure that you're flossing correctly and, how often should we brush? And obviously every 6 months coming to see you for cleanings. Like what are
Absolutely.
the blocking and tackling of dentistry that we need to know?
So small circles is the biggest thing. We always want to make sure that you brush the gum line. Everything accumulates at that crack where the gum and the teeth meet. And I think a lot of people say they brush, but they don't brush properly. So if you don't brush properly, it's not like you're brushing at all. You want to make sure that you get all the way up to that gum line. If you don't feel that toothbrush hitting the gums, you haven't done your job. Teeth, I always tell people when you take a shower, you don't just wash the front of you wash the back. The same thing with teeth. Teeth have all different surfaces. Make sure you get the front, the back, the sides, the tops. Make sure you floss twice a day if you can. Bring your child in as soon as they get their first tooth, or 1 year. We usually like to say 1 year. We want to see you every 6 months, and then that way we can check up on you. A lot of things can't be prevented, major issues, if we catch them early. When you have a broke tooth and it is really badly decayed, a lot of times the only option is extraction. Root canals are very expensive, and sometimes our population can't afford it. So we want to save teeth. Naturally, we can never replace what God gave you. So flossing, checking up with us, making sure that you come back. If you feel anything different or off, never be afraid to call the dentist and say, hey, I might need you to check something out, even if it's between that time, because we want to know.
Yeah, nice. That's good. I like that. Let's go ahead and talk about partnerships, because you alluded to Smile180 Foundation. Delta Dental of Tennessee, I know, is a big partner of yours. Talk about the Smile180 Foundation, Delta Dental of Tennessee. Talk about that collaborative partnership.
So Smile180 and the Delta Dental Foundation have been very instrumental in neighborhood health. We could not do majority of what we do without them. They're almost like our guardian angel. When we ask for something, they come through. We tell them a problem and they solve it. So it gives a less pause for me on my side. Smile180 was introduced over 3 years ago, and we were one of the pilot clinics that were chosen. And so what they did is they came and said, what do you need? And we said, there's a lot of people who we take out the teeth, but we can't replace. We give them this bill, and although we think it's a small bill, it's pretty astronomical. The average dentures run between $2,000 and $3,000 in private practice. So we were charging almost half of that, and it was still hard for our patients to come up with that money or those funds. So Smile180 came in and said, guess what? This is what you're going to do. We have a pot of money for you guys, and these are the requirements you have to have so far as be a resident of Tennessee, have no dental insurance, and then they will pay a low or reduced cost for it. So if you think about dentures being $2,000 to $3,000, Smile180 has reduced that where we're charging our patients less than $200. So that's a lot of money that they can utilize elsewhere, or for maybe another family member. Delta Dental has come in and said, hey, guess what? What do you need? We've got pan machines at all of our locations. Our locations are top notch because Delta Dental has stepped in and said, whatever you need, we're going to make sure that you have it. We all have digital sensors, x-rays, so we're able to look at real time from clinic to clinic. So we can go back, and if we need a second opinion, we can do it right there on the spot.
One of the other things as you're talking, I'm thinking, one, obviously the efficiency for you all as a team to have the latest, greatest technology, but also for your patients to come in and to see that you have the top-notch equipment and they're being treated with respect and empathy, but with the top-notch technology. What do you think that means, not only for your team, but for the patient? I think it makes a big statement, but what do you think?
It does make a big statement because they know that we're here to serve them, but we're going to serve them in the best manner possible. Just because I think public health has a negative connotation to it. When you think of a public health clinic, you come in, most of our clinics are very open and inviting. Before COVID, we had kid areas, not so much now, but we want to make sure that all of our equipment, everything that you see, the state of the art of everything is what we have. And we've been able to do that through partnerships with Delta Dental and Smile180. That also helps us put that money back into our clinics for our patients so we can use the best materials, because now that cost is offset. We don't have to absorb that cost so far as Delta Dental and Smile180 have helped us absorb that cost that we would have to normally charge the patients for the dentures.
I know you and I met at a workshop that Delta Dental of Tennessee was putting on with the Smile180 Foundation and bringing in different guest speakers. And the whole idea was, how do we help you as charitable dental clinics be more successful? And so I think that's another unique opportunity when you look at just the collaboration with different entities, pouring in with workshops. Give me one other way that Delta Dental of Tennessee or the Smile180 Foundation has been a benefit for you all.
So Delta Dental, I came to neighborhood health 6 years ago. And one of the things I talked to the past CEO about was, what do you want? And she said, marketing. We've got to get our name out there. We've got to get dental out there. So I just happened to go online and find someone. It was Delaney Walker at the time. And I said, we're going to have a celebrity dental day. I contacted Phil Wink, the CEO of Delta Dental, and he was on board. He said, whatever you need. And I was kind of taken aback, whatever. And he said, whatever. And he and Delta Dental have been a great supporter of our Celebrity Dental Day. So Celebrity Dental Day happens once a year. Last year we had Brandon Wright, and this year we'll have Brandon Wright again. And so we invite neighborhood children in to have a screening, to have a look at our clinic and to have fun. Okay, I don't ever want the kids to come to the dental clinic and think that it's a scary place. So we invite them in. We have food, we give them screenings, we have a good time, play music. And it's all about letting them know that we're here for them, but we also want to take care of them. If we see something, we're going to let them know. But Delta Dental has always been a supportive entity for us, and we thank them for that. I mean, without them, we couldn't do it. As a public health, we don't have a lot of money, right? So we look for people to sponsor us and to be great partners with us. And Delta Dental has always done that. This year, July 13th, we will have another Celebrity Dental Day with Brandon Wright at our neighborhood health clinic and invite all the kids out and have a good time.
I love it. That's awesome. Wrap up on your end with two things. One is talk about ways that all of us can support your efforts. So how can the community help? Obviously, charitable donations, corporate sponsorships overall. So talk about some of the different ways the community can help. Let's start there.
So if you want to help Neighborhood Health or any of the other dental clinics, start by contacting our CEO, Brian Hill, and you can find his email address and phone number on our website. We're always in need of partnerships. So what that looks like is maybe volunteers, screeners, greeters. If you want to sponsor, maybe you think, hey, guess what? I want to give some money to make sure that the children 1 and under who don't have dental insurance and who cannot get dental insurance because of their resident status, I want to make sure that they're getting the necessary cleaning and sealants. You can put money in a bank for that. Anything that you want to donate, we're more than willing to take. As always, we're a charitable organization, so we don't turn down anything.
Yeah, that's all great stuff. So go ahead and wrap up with website, social media, phone number. Where would you direct everyone to go to learn more?
If you want to know more about Neighborhood Health, I invite you to go to our website, which is neighborhoodhealthtnfortennessee.org. We also are on social media, Facebook, Instagram. If you would like to make an appointment, 615-227-3000. They'll take great care of you. Just let them know the closest location or clinic that is closest to you. If you'd like to volunteer, 615-227-3000, or go on our website. We have organizational volunteer opportunities there for you also.
Perfect. Well, Michele, thank you for all you and your amazing team do. Thank you for coming on the show.
Thank you very much. You have a great day.